We're going to start by blotting the skin with a tissue folded into a triangle. Starting at the forehead, press firmly to make sure you're picking up any moisture from the skin. Remember, don't throw the tissue away. We'll use it to clean off the blade in between. Keep the tissue on the same side you're working on to avoid crossing the blade over the client. Gently use both hands to turn the client's head to the opposite side of where you're working. Make sure they're lying as flat as possible, then have them slightly lift their chin. Shift your body to the side you're working on to ensure the blade is always moving in your direction. Use your whole thumb to lift the skin and your index or middle finger to hold it taut, creating a C shape. To help stabilize yourself, you can rest your wrist on the client's forehead while holding the handle in a feather-light grip. Another option for holding the handle is the overhand grip. Try both and see which one feels more comfortable for you. When dermaplaning, the blade should glide smoothly at a 45-degree angle with light feather-like strokes, always keeping the skin taut and the blade moving in your direction. You don't need to collect the dead skin or vellus hair with your blade. It's okay to go back afterward and lightly pick up any leftover debris with your fingers. Continue in upward motions along the cheek area. If you encounter a dent in the skin, readjust your hand placement. If you notice the skin moving with the blade, it's a sign you're not holding the skin taut enough. Make sure to use long, controlled strokes, always working in the area where the skin is being held taut. Right-handed esthetes should avoid positioning the blade over the client's left eye. Move to the opposite side and work inward toward the nose, using your thumb to stretch and stabilize the skin. Halfway through, reposition your hands to keep the skin taut. When making adjustments to the client, always place the dermaplaning handle on the cart. Look over the area you just finished to make sure nothing was missed. If you need to do a touch-up, move vertically up the face. The maximum number of passes is 2. If the client has a raised mole with hair growing from it, stretch the skin and glide over the area without making direct contact to remove the hair. As always, check in with your client to make sure they're comfortable with you doing the removal. Place the blade on the cart, use both hands to position the client, and move the tissue to the new side you're working on. On the right side, when working on the jaw, plant and lift the skin. Work diagonally to avoid leaning on your client. This pattern will also be easier to perform if the bed is positioned close to the wall. When approaching the sideburns, bring out the mirror and check with your client how far up they're comfortable with you going. For left-handed estheticians, position yourself on the left side of the client and work inward, as demonstrated earlier. Move your client to the center and have them lift their chin slightly toward you. Then begin on the chin bone. You have two options. Work across the entire chin bone or divide it into two sections. When working across the chin bone, work in small sections and stabilize yourself by resting your wrist on the client's forehead. If working across the chin bone doesn't feel comfortable, work on one side at a time. Plant and lift the chin as you work towards you. Move on to the chin area. To keep the skin taut, you can either make a fist and use your index finger to anchor just beneath the chin bone, or open your hand and use your middle finger to gently pull the skin downward. Ask your client to tuck their bottom lip in to create a smooth surface. As you glide the blade upward along the chin, pause halfway to adjust your hand position and maintain proper skin tension. Give your client a quick break between sections, as it can be difficult for some to hold the position. Check if your client wants their upper lip done. If yes, work in three sections: left side from nostril to mouth corner, center, and right side from nostril to mouth corner. Apply water to the area you are working on and tilt your client's head slightly to the opposite side. Glide the curved part of the blade down toward the mouth corner, keeping the blade at a consistent 45-degree angle. If your client cannot tuck their upper lip inward, use your thumb to gently stretch the area and your index finger to stabilize the skin. Think of it as spreading the skin apart rather than pressing down. If your client is able to tuck their upper lip inward, still use your thumb to gently stretch the corner of the mouth downward. Apply water to the center section and have your client tuck their upper lip. Keep the skin taut with your thumb and index finger as you move the blade upward, using either the curved portion or the entire blade. Your dominant hand will determine whether you use a feather or overhand grip. You will either work from the top of the lip, stabilizing on the forehead, or from underneath, stabilizing on the chin, as previously shown. To clean the sides of the mouth, have your client slightly open their mouth to help stretch the area. Stabilize the skin with your fingers while working the blade upward. Finish with the forehead. Pull the headband back to the hairline, hold the skin taut, and glide the blade upward. Avoid removing baby hairs near the eyebrows, and inform your client that this area will be skipped to preserve the natural hairline and eyebrow shape. If you have any questions, please reach out to your lead esthetician or a member of the training team.